Fertility preservation is a term that is used to describe the freezing of reproductive tissues, so that would apply to both men and women. In males it would refer to freezing of sperm, and in women it would refer to freezing of eggs or fertilized eggs, which are called embryos, and in very select cases you can even freeze whole pieces of ovarian tissue. The purpose of fertility preservation is to freeze reproductive tissues when a woman or a man is facing a fertility, a diagnosis which is going to permanently impair their ability to have genetically related children in the future. And so you preserve the eggs or sperm before treatment or before a diagnosis is going to lead to that depletion of reproductive tissues so that they may have children in the future. Fertility preservation originally was meant for cancer patients, most commonly who are facing chemotherapy or radiation, but the definition has been expanded greatly in recent years to include women with certain genetic diagnoses, women who need repeated surgery on the reproductive organs for diseases such as endometriosis, for example, and additionally can include some surgical procedures which have been modified to allow preservation of the uterus for future potential use. Actually, in men, age is much less important than it is for women. Sperm will regenerate itself throughout the lifetime, and age and fertility rates, although there's some decline in fertility in older men, men remain fertile well into older age. Women, on the other hand, are born with the number of eggs, which is how women reproduce, that they're going to have throughout their lifetime. And that number steadily declines from birth, actually. That number accelerates, or the decline is more quick once you enter your mid-30s and early 40s in most women. So fertility preservation now also refers primarily to women who wish to preserve their eggs as their fertility window may close before they meet a partner that they would like to reproduce with. The difficult thing for women is that it varies based on the individual when fertility is going to become an issue for them. Even women who have a good amount of eggs in the ovaries, they are at increased risk for genetic abnormalities in their offspring when they're older. For example, things like Down syndrome become much more common in women as they age. That does not hold true for men. Yep. So fertility preservation for men includes providing ejaculated sperm for its cryopreservation. And typically we encourage men, especially who are facing a fertility threatening diagnosis such as a malignancy, to try to bank as many specimens as they can prior to treatment. For women, it is more complicated. The woman will go through for egg or embryo freezing, which are the two most studied and proven methods for fertility preservation. Essentially, they will go through an IVF cycle. They will take the medications that you would take for IVF or in vitro fertilization to stimulate the growth of multiple eggs in the ovary. And then those eggs are surgically removed through a vaginal procedure, a day surgical procedure, and they are either fertilized with sperm to create embryos, and then those embryos are frozen, or the eggs can now be frozen without fertilization, and those would be frozen just as single cells as eggs. So it's essentially the process of in vitro fertilization without the embryo transfer. And then when a woman wants to use those materials in the future to have a child, the eggs or embryos are thawed from their preserved state, the uterine lining is prepared, and the transfer is done. In the case of egg freezing, at the thaw, those eggs would then be fertilized with sperm from the partner of the woman or a donor sperm prior to transfer. Healthy babies have been born after embryos which have been cryopreserved for more than a decade. So as far as we know, there is no time limit on the utilization of reproductive tissues. And this is actually a really important point, because as survival rates for childhood malignancies, for example, a cancer, something like Hodgkin's lymphoma, which is very common in the teenage and early adult years, those women may freeze eggs and not want to come back to use those eggs for 10, 15, even 20 years. And as far as we know, there is no expiration date, so to speak, on the ability to use those tissues. The recovery time for men is none, basically. For women, they do get anesthesia. People who are undergoing in vitro fertilization or an egg retrieval do receive anesthesia. And so that day, people may feel groggy and out of it and have some soreness related to the procedure. The vast majority of women feel just fine to go about their normal daily life 1 or 2 days after the procedure. And in fact, many women have been able to initiate treatments such as chemotherapy within 48 hours of an egg retrieval.